On the upright abdomen, you have your patient place their back up against the board, because oftentimes they are interested in the kidneys, and this gets the kidneys closer to the IR. Now you can always accomplish this in a PA projection, which does result in less radiation to the gonadal area, but it does have the kidneys farther away from the IR. So that's why you often see in an AP projection. Okay, now I've got my 14 by 17 loaded in lengthwise so that we can have the length of the abdomen. Now, on the upright abdomen, you want to palpate for the crest, which is right at this level. But because we want to include the diaphragm, we want to go 2 inches above that. So we will be higher than on the supine, and again, you want to check for the mid-sagittal. Now I'm going to adjust my bucky tray because I have moved my tube up higher, so we want to make sure that the bucky tray meets that. Okay, and then place your marker indicating which side of the patient's body. I've placed a left marker to the left edge of the IR, indicating this is the left side of the body. Okay, so on our upright abdomen, you want to take in a deep breath and then blow that breath all the way out, hold it out, and then take that shot. You can relax. Again, remember when you're doing abdomen x-rays, you want to have the patient in a gown. Have them take the pants off. You don't want any metal on there, and preferably the bands on underwear can show up as a dark density, so it's even better to have the underclothes off as well. For females, you want to get the bra off because a lot of these bras have underwires. Because we are shooting higher, wanting to have the diaphragm on this, you don't want any underwires in the way. Okay, now, if the patient's not able to stand up for their upright abdomen, we're going to do the left lateral decubitus on the stretcher. And usually these patients, they arrive in the department on the stretcher already. So, with your patient on the stretcher, you're just going to have the stretcher up against the chest board. So David's going to lay down on the board. There you go. He's going to lay down on the stretcher. And you want to be sure that you lock your wheels in. Because if you don't lock your wheels in and you have the patient right up against the board, one little movement can create the stretcher to move and your patient to fall in the floor, and you don't want to have to deal with that. So with the left lateral decubitus of the abdomen, I like to prop a sponge under the patient's side to build up the side that's down, because sometimes you can't cut that area off. Okay, next I want to be centered mid-sagittal. Okay, and I'm going to bring my chest board down so that it is going to be at the same level. Now hold on, David, I'm going to move my stretcher out. There you go. Because I have to lower the board down even more. Okay, now I can come up just a tad. So it is a little more difficult to maneuver sometimes when you're dealing with the stretcher and the chest board. Okay, now because I'm going to be centering 2 inches above the crest, you want to be sure that your patient is going to have to scoot down a little bit because my stretcher won't not move down further. So here we are. This is going to be 2 inches above the crest. This is going to be mid-sagittal. And one thing I see wrong with this at this point is my IR needs to be turned so that it is going with the length of the body. So to do that, I'm going to have to take this out, See, I was all set up for an upright, but my patient cannot stand. So you'll just put your film in crosswise. And that way, we're going to get more of the length of the body. So this is our left lateral decubitus. Our right side is up, so I'm going to put my right marker in this upper portion of it, indicating the side that is up. If you have a little arrow marker, you can place your arrow on here pointing up also. So with this left lateral decubitus abdomen, you'll shoot this on expiration. So you'll instruct your patient to take in a deep breath, blow that breath out, and hold that breath out. Then you would take your exposure. You want to be sure that you have the diaphragm included on this when you're checking your resultant image. Okay.